my name is Narada Immaculate, and I'll be doing my remediation of my folic insertion of folic catheter on my female patient. So my evaluator requested that I start from the wrapping my folic kit, and then yeah, that's where I should start from. So I'm just going to give you a brief of what I did, and then I can start from what my evaluator told me to start from. So prior to this, I actually provided privacy. I then introduced myself to my patient, asked for any allergies, and they told me they didn't have any allergies. And then I said, remember, I have my trash can in between my patient and my non-dominant hand. And then I also explained the procedure. I made sure that I confirmed the orders that the health provider provided, and the orders were Miss Smith, your health provider, requested that ordered that we perform a Foley insertion of a Foley catheter on you. So I went ahead. I also looked at I looked at the preliminary area, and then I assessed for any skin damage and anything unusual or abnormal. And then after that, I doffed off my gloves and then trashed them. So this is the part that my evaluator told me to start from. So at this stage, I again explained the procedure to my patient. Hi, Miss Smith, I'm going to be performing a Foley catheter on you. Your health provider ordered that I do that. So I go ahead and perform hand hygiene. After performing hand hygiene, remember I've positioned my patient in a spine position where the legs are bent and then looking up, so I can be able to actually see the whole area very well. So after performing hand hygiene, I then unwrap my Foley catheter kit and then take off my kit and trash. Get up and trash. So at this stage, I'm actually setting my field, my stereo field. So I go over the first one. I should go over, and then the sides, and then the fold that is close to me should come in last, so I don't have to go over the field, the stereo field. That will be breaking sterility. So I start by this, and then I go over the sides, and then this comes to me like you're saying. So I should be very mindful of the 2-inch borders. So at this stage, I am able to see my opened kit and what is contained within it. So I only pick out my stereo gloves, and then I go open them away from the stereo field. I have to be very mindful of the 2-inch border, so I don't contaminate my stereo. I don't break sterility. So I open it wide. After that, I get my non-dominant hand, and then I pinch on my cuff, and then and then I get my 4 other fingers, and I have my cuff. So I make sure that I don't manipulate my cuff, and I pinch and then trash. So after I've done that, I can see everything. I'm able to see everything. Then I request my patient to actually to lift up, so I can be able to put the drip down. So I have my drip. Hi, Miss Smith, I would like you to actually lift your hip up so I can be able to put the drip up below you. So I have my drip, and at this stage, mine is a white one. It's not blue like the usual one. So I press it down. I don't touch it. I leave it there, And then after that, I get my white drip and then press it on my patient. I don't touch it again. I don't try to manipulate it. I don't try to move it around. So then I set my supply or my field. I make sure that I don't cross my hands over to my field, and everything has to be within the 2-inch border. So at this stage, I've opened, then I get my my alcohol swab, take it out, take out my alcohol swab, and then I make sure that I go besides, so I don't cross over my sterile field and I don't contaminate it. And then I get my lubricant, put it in a container, and then pass it away from my sterile field. And then I get my my catheter tube. Take this off. So I have my tube, and then I get my syringe. Take this off, okay, and I attach it to my tube. So after I finished attaching, and let me try and this, so I can be able to attach everything. I make sure that I put my tube in my Vaseline. So at this stage, after I've done preparing everything, I then tell my patient, "Hi, Miss Smith, I'm going to be cleaning your perinary area from, but it's going to be a little bit cold. It won't take a long time, so just be patient." So I get my non-dominant hand, and then I press it open wide, the labia, like this, with my non-dominant hand, and then I cleanse the meatus in an anterior-respiratory direction. So I go up, open the labia, further out, down, I drop it, and then I go closer, further, and then drop it, and then I go this side, and then up the urinary meatus to down, and then I drop it. I still have my hand on my my non-dominant hand, so I don't take off this hand. So I get my tube. I explain to I explain this to my patient. Miss Smith, this is going to feel a little bit uncomfortable, but I would like you to inhale and exhale. So exhale, so I can be able to put it. So I insert it 2 inches inside. Make sure that it goes 2 inches inside. So if I'm able to see any urine coming out, I go further, insert it more, 2 to 5 inches inside. And then I get my non-dominant hand. Remember, I opened, and then I hold it. And then I tell my patient, "Miss Smith, I'm going to be inflating, so stay still so we don't contaminate the field." So I inflated. then take off the syringe. And then toss it. So I again go ahead and hold it, see if it's tight enough. So at this stage, what I do is I clean off, I unwrap and then clean off. Done. Using the stereo drip, dry, and then I trash, and then I get the bag. Make sure that the catheter is inside my patient. I put the catheter in the middle of the legs of my patient, and then I put the bag down below my patient at the mattress. So I look at the urine, see if it's cloudy or it has anything that is weird. At this stage, it's clear. So I put it there as I put the catheter in the middle of the legs of my patient. So after I've done all that, I've dropped the catheter down, the catheter bag. Then I'm done with the procedure. I thank my patient. Thank you, Ms. Smith, for allowing me to do this. And then I doff off my gloves. In a secure way, and then I clean off my unused supply. And then after doing that, I position my patient in a comfortable position, and then I perform hand hygiene. After performing hand hygiene, I then go ahead and document my procedure. Thank you.